And one of the battles that I've had in the past 15, 20 years, out of the 30 years I've been doing this, out of 43 years practicing medicine, is that everybody believes that in order for you to have hormone dysregulation, you need to have trauma to the pituitary. You need to have damage to the pituitary, but that's not the case. You can have damage to the hypothalamus, or you can have inflammation that dysregulates the communication between the hypothalamus and the pituitary. And that's what I'm seeing in all the cases of our military. And the misperception is that you need to be knocked unconscious to have a traumatic brain injury be meaningful. Not so. Not so. We have two groupings, if you will. One is called subconcussive, or out there they like to call it repetitive head injury. Well, subconcussive is where you have a ding, a minor impact, a minor event, which doesn't create any immediate symptoms, overt immediate symptoms. And that's subconcussive, as opposed to the concussive, where you have a concussion and you immediately have problems: nausea, vomiting, blurred vision, double vision. You might be in a coma, or you might have disorientation or cognitive impairment. You might have memory loss, proactive memory from the incident forward for a short period of time, or retrospective amnesia from now back. So you don't remember how you were knocked unconscious. Okay.
Wow.
So the difference between the two is, with the concussive, with all the initial symptoms, is that starts the process immediately. You stated in an earlier conversation we had that within a day of your trauma, you started to have changes in your personality, cognition.
It was I was knocked unconscious. I hydroplaned into a guardrail going 60. So upon impact, I was knocked unconscious. The moment I woke up, I had symptoms. The way that I was responding to things, when I was taken in the ambulance, I'm afraid of needles. So when they tried to give me an IV, I flipped out. I literally felt like they were trying to kill me, instead of just being slightly uncomfortable. And that lingered for many, 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 many years.
Yeah. Yeah, we've had a couple of people who have had a traumatic brain impact injury without loss of consciousness, knocked to the ground. The next day he wakes up, totally different person.
Oh yeah, yeah, completely different, stranger.